Okay. So about roughly how many pills do you take a day?
I take 30 pills a day, 6 with every meal.
And what are your medications called?
Enzymes, they're Creon 20s, and then they also take like inhalers and stuff.
Mm-hmm.
Want me to
And
name those too?
yeah, that's fine.
Um, I take albuterol, I take pomazine, I take hypertonic saline, and that's it right now.
And like, what are some of the treatments you do?
Um, One of them's an inhaler. I do 2 puffs a day. Then the other one's a nebulizer,
Mm-hmm.
and I do that for 15 minutes. And then I do a vest, which vibrates like my chest for 30 minutes
Mm-hmm.
a day.
And like, what are some of the symptoms you have? Are they like bad sometimes, or?
um, well, yeah, like when I get a cold, I get like a really bad cough, and
Mm-hmm.
like I wheeze after I run if I have a cold. Um, I get really bad stomach aches if I don't take my pills,
Mm-hmm.
and that's pretty much it because I have like a mild case.
Yeah. Um. Well, do you consider yourself more healthy than others?
Yeah, definitely.
Do you think it affects you that bad, or?
Not really. I mean, some days it does, but then other days, like, you can't even tell I have it.
Mm-hmm.
It really depends on, like, the weather and stuff and how I'm feeling.
Yeah. Um. So, what do you know about CF? Like, what's your general definition of cystic fibrosis?
Um, it is genetic, it's progressive, it's a disease that affects my lungs and my digestive system.
Mm-hmm.
There is no cure as of right now, and it sucks for the most part.
Well, at least you're healthy. Um. Have you ever had doctors like test on you or experiment on you or no? Anything?
Yeah, I was in I'm currently in a clinical trial. I've been in it since I was like diagnosed. It's called the EPIC trial,
Mm-hmm.
and they just like submit all my medical records to be studied. And then I was in another clinical trial for this new medicine they had called the Nufisol, and I was in that for 2 years. But then they found that the medicine actually wasn't working, so it was like a waste of 2 years. But
Happens.
yeah, yeah.
Um. What was I gonna ask you? I forget what I was gonna ask you. Hmm. I forget. Um. Well, have you heard of any new studies? Do you know about some of the studies going on?
Um, there's a new pill they have that it's only for one form of the gene though, and it like wipes out all symptoms.
Mm-hmm.
So if like you get a sweat test, which is how you diagnose CF, is like through a sweat test, and if you give the person who has the pill a sweat test, they don't test positive for CF anymore. So it's like technically a cure, but it's only for one form of the gene so far.
And you don't have that gene?
No, I have a different one.
Okay. Um. Um. I have to like talk about information from some of my papers. So
Mm-hmm.
they're like from other studies, and it says the FDA approves drug for cystic fibrosis. Pollack stated the U.S. Food and Drug Administration approved um, the first drug called Calideco to treat the cause of CF. Have you heard of that before?
No, I haven't. I might not just take it though,
Yeah.
because there's different forms of it.
And Pollack said that like CF have a lot of mucus buildup, and that helps. That like makes it hard for them to breathe because it's in the airways. Does that happen a lot for you?
Yeah, the difference is like the mucus in my lungs is different from yours because mine's really thick.
Mhm.
Like it's like doctors compare it to like peanut butter.
Yeah.
When yours is more like water.
Mhm.
So mine gets like stuck and then it hardens and like deteriorates the lung.
Mhm. And about like roughly what's the age limit now? Like the expectation?
The median survival age is 37. That's only median. So
I think you'll live past that. So you don't feel different at all? Like you just you don't feel like your life's different with CF besides the medicines and everything?
I mean, I look at it in a more positive view. Like if I sit here and compare myself to all my friends, then obviously like I notice I have it because they're not taking these medicines and I am.
Yeah.
But compared to like the entire population of the world, like I consider myself lucky.
Yeah.
Because there's so many people going through like so many different hardships. So.
And when were you diagnosed with CF?
When I was 5.
And how did your mom and dad know that there was an issue?
I had really bad stomach aches, and when I was little, my stomach was like always bloated. And you didn't know it was wrong, and I was always crying after I ate.
Yeah.
I had stomach aches. So the doctors thought I was lactose intolerant for a while.
Yeah. And it says Centofanti studied in the 1950s patients who battled the infections of cystic fibrosis suffered from malnutrition. Do you ever suffer from malnutrition?
No, because my appetite's good, but
Yeah.
I know like a lot of patients who have had to go on feeding tubes because they just don't have an appetite and they're underweight. But I like to eat.
Yeah, so do I. Do you know a lot of other patients?
Yeah, I can't physically talk to them though,
Yeah.
because we can get each other sick. But
Yeah.
I know of them.
And you've done you've spoke places, right, about CF?
Yeah, I spoke at the comedy night. 3 years ago. That was fun.
Yeah, looked
It's a
fun.
big crowd.
Yeah. How many times have you been in the hospital so far for CF?
This pet, a year ago, I never had to stay overnight. I've only been in for day stay, which to get a PICC line in.
Yeah.
And then...
What's a PICC line?
A PICC line is an IV that goes in your arm right here. You can see the scar. And it's like antibiotics. I had to have it in my arm for 3 weeks. And then I just had little IV things that were just in my fridge at home.
Okay.
I could do the IV at home.
So what are some things that other patients have to get done, surgery wise?
Recently, a 26-year-old we knew had to get a double lung transplant.
Oh wow.
Yeah, she went through that, but she's fine now.
That's good.
People get PICC lines all the time. That was my first PICC line, but I know 2-year-olds get PICC lines all the time. People stay in the hospital overnight and stuff like that. People get bronchoscopies a lot. I've gotten two, and it's they put a camera down up your nose and down into your lung to look at your lung to see what's going on.
I think that's it.
Alright.
All right. Well, thank you.
Yeah, no problem. Good luck.